Well, hello, everyone. Welcome back for day 3. Hey, we're wrapping up your pharmacology NCLEX review, and I'm so excited that you're here tonight because I know it is really rough at the end of a semester to try to think about pharmacology, but you are so close to your goal of becoming an RN. All right, now there's a couple things that'll help you really get the most out of this session. So if you've got some scratch paper, you might kind of want to grab it just to take some quick notes, because the whole purpose of tonight is for you to be very clear on how you're going to set up your study plan for getting ready for the NCLEX. Now, as you know, as we said for both nights 1 and 2, if you didn't get to make it through all the pharm video content, that's okay. No judgment. We're just glad that you're here tonight because what we're talking about is your brain. As you know, I love educational psychology. It fascinates me how our brains work, how we process information, how we encode information, how we get it in the right spot in our brains, right? Because you want to be able to retrieve it, first of all, on the NCLEX, but then more importantly, as a nurse, because we all want to keep our patients safe. Remember, patient safety, right? For this particular patient in this particular setting, what keeps them the safest is going to be the best answer and the prioritization answer to those questions that always have more than one right answer. So I want you to be thinking about your brain as a very valuable resource. Sometimes nursing school makes you feel like you're just not that sharp, doesn't it? It makes you feel like the slow kid in the room, but you're really not. You're here, you're thinking about your NCLEX exam. You're really bright. So I want you to think about your brain as an amazing and incredible machine, right? It's a tool, it's a muscle, it's an organ, and we can teach it and train it and make it stronger. So let's start talking about how you want to invest your brain, your mental energy, this incredible machine, in getting ready for the NCLEX. Because see, nobody's telling you what you have to do. From here on out, how you choose to prepare, that's all on you, right? There's nobody going to grade your preparation. You are all by yourself with a circle of friends that can also help and be support for you. But you're the only one who makes the decision on what you're going to do and how much effort and energy you're going to put into getting ready for the NCLEX. Now, that's not meant to be a guilt trip. My goal here is to help you recognize where you're wasting brain energy. If you're a worrier, if you have anxiety, which most of us do when it comes to a big life event like this, but I want you to recognize where some of that energy is being wasted, and we'll divert it so that you can have a life. No, I'm serious. I want you to have a life while you're preparing for the NCLEX. I am a firm believer that you need to spend time with friends. You need to spend time with your family. You need downtime completely away from NCLEX. And yes, I said it and I mean it, and I'm going to show you how you will do better on your NCLEX if you take a reasonable amount of time. Okay, so let's talk about the supplies that you need to be successful. Now, you don't need to have them all right here, right now, tonight, right? But these are the things that you're going to want as you're getting ready for the NCLEX. Number 1 is a write-on wipe-off board, or you could use a piece of scratch paper. But if you go to the dollar store, they're $1. So if you pick one up, the reason why I would encourage you to get a write-on wipe-off board is because when you go to take the NCLEX exam, they're going to give you one. Now, your proctor at the exam is an employee of the Pearson VUE Testing Center. Sometimes they're really strict, sometimes they're not as strict, but you want to go in prepared for the most strict proctor, right? So this write on wipe off board, there's some rules with this. You cannot write on it until you've actually started the questions of the NCLEX. So don't sit down and try and write a whole bunch of things down. That's a brain dump, and they don't want you to do that. You're likely to have the board removed. Now, let me give you a heads up. If a proctor ever comes to you and says, hey, I need to take your board, immediately just smile and be polite and say, absolutely, My bad, my apologies. Can you help me understand what I did so I don't do that again? See, treat the proctors like TSA agents. If I want to fly somewhere, I don't mess with the TSA agents at the airport. If they ask me to do something, yes, ma'am, yes, sir. What do you need from me? See, they're trying to keep us safe in the air. And so, whatever they need me to do, I'm not going to give them any problems because if I give them problems or attitude, I'm not going to make it on my flight or my destination. Same thing with proctors. They're trying to make sure that everyone who takes the test earns their passing grade. That's what they're there for. So don't panic. If they tell you you've done something that's inappropriate, just ask them what it was to be sure. Hand everything over. This is not the time or place to argue. So I encourage you to use a write on wipe off board while you're practicing. The more you get yourself in the same type of atmosphere that you're going to have when you take the test, that's the best for your brain getting ready. So you could use a piece of scratch paper. It's not the end of the world, but remember, use that board or scratch paper, whichever one you want, to write down 1, 2, 3, 4 for each question and make sure that you eliminate answer choices. You cross through the numbers and you say why. If you'll be religiously faithful about doing that process, eliminating answer choices and saying why, you're going to see a definite increase in your score and a decrease in the amount of questions that you miss something in the stem of the question or in an answer choice. So the first thing I recommend, write on wipe off board. One more thing, that's a little bit of a misnomer because you can't erase your own board in a testing center most times. You can write on it, but when it's full, you look in the camera and you wave to them, hold up your board so they know that you need a new board. They'll either bring you a new board or they will come and erase your board, but you are not allowed to erase your board. Don't ask me why. I don't really understand it myself. I just know them's the rules. And you always want to follow the rules when you're taking the NCLEX. Now, the second thing I want you to have is a parking lot piece of paper or a pad of paper. Now, I have one available that I just make like this. You're welcome to use it if you want to, but it looks like this. So you can see in the upper corner, it just says Professor Lawes Brain Hacks. I've got Professor Lawes' procrastination parking lot. This is right what it says down there. Things I only want to do when I'm trying to avoid preparing for the NCLEX. So this is a personal tool that I use when you're sitting down and you're focusing for your set period of time to prep for the NCLEX. When you get those wild ideas of things you want to do, you don't leave your seat, you just write them on your parking lot, go right back to prepping. Okay, so when you're done on your break, if you'd like to invest in those things on your break, go ahead and do them. But I pretty much guarantee you, you will not be that interested in doing those on your break. It's just because your brain is screaming, I don't want to do this because it's hard. So plan ahead for distraction and make sure you have that available to you so you don't get sucked into those distractions. So we talked about a write on wipe off board. We talked about your parking lot piece of paper. The third one is a notebook. Now you can use a 3-ring binder, you can use a journal, whatever you like to use, but here's the deal. Please keep this with you on a daily basis from the time you start studying until the day you take the NCLEX. Okay, so you need a notebook where you put everything in one place. As you're reviewing questions and you get these little precious nuggets of information, what I want you to do is write it down in your notebook. And then you're going to review your notebook on a regular basis. You're going to ask yourself those questions. Hey, why would I need to know this? And 2, how would it help keep patients safe? You're going to write in your notebook in the worst case scenario format that we've talked about in sessions 1 and 2. This is going to be gold for you. Nobody wants to go back and reread their med-surg textbook. You don't have time or energy. Nobody wants to read their maternal health textbook. But as you're going through and prepping for questions, because that's what's most important now, you start hitting those NCLEX type of questions, write down the nuggets you learned from the rationales, the rights and the wrong in your notebook, review them regularly. That is really targeted study. That will help you supercharge the time that you have available to invest. Remember, think of that slide with the one lit light bulb. You get to decide how you invest your energy. And what I recommend is invest your energy in the areas that have been difficult for you. You'll find out on questions that you miss when you're reading the rationales. Now, number 4 is your favorite writing institute. I really like pens. So like these are my favorite brand of pen, and I always have lots of colors, and I keep them on my desk in my very special cup, all that kind of stuff, just because I like office supplies. But none of that is magic. If you just want a regular old pen or whatever, it doesn't mean anything to you, then just use whatever you have. But if you're kind of an office supply nerd like I am, splurge a little bit and get something that you really like using. I encourage the use of color when you're taking your notes in a way that benefits you. Some people just like black or blue ink, totally fine. You do you. You do what you like to do, whatever works for you. But just keep in mind, when your brain sees a page that's covered from words from left to right and top to bottom, it's really hard for you to process that information. So when you're taking notes, leave yourself margin, leave yourself white space, use color, put boxes around headings to help your brain see the divisions and group information together. So that's a real helpful strategy when you're trying to encode information in a way that's helpful. Number 5, you need a timer app. Now, I recommended about 4 or 5 of them to you yesterday that you could try. You can put them on your phone. You can put them on your laptop. You can just use a kitchen timer. It doesn't matter, but you want to be accountable for time. Because we talked about it yesterday, boy, the clock seems like it has died when you're studying. It just seems like you've been studying forever and you really haven't. Now, this is the app that I like to use. It's the Focus to Do Pomodoro Timer and To-Do List. What I love about it is it tells me every day what my total is, and I recommend that you keep track of that. On your study plan, one of the things I would love for you to track, it's only between you and your study plan, is how much actual productive study time have you put into the NCLEX. Again, this is not a guilt thing. This is when you do the work, you can walk into that NCLEX with your head held high and say, listen, I've put X amount of hours into prepping for this test. I did my very best. There's no reason for me to be anxious now because that's not going to help me. So I'm going to focus on what I have done and do my very best. Okay, so we've got those first 5 things. Number 6, it's not really a supply, but I wanted to put it on here, is you need the ability to turn off your notifications on your phone and your laptop. So this might mean you might need a babysitter to watch your little ankle biters so you have time to really focus when you study, if possible. I know that's not always possible for some of you because you have family responsibilities, and so you can't do that. But when you can, try and really minimize your distractions, particularly the notifications, which on any computer, you can turn those off for a certain period of time. You can also do that with the apps that I recommended on your phone. So as much as you can, make sure that you turn off those types of notifications. Now, number 7 is you need NCLEX practice questions. You can use any service that you like. There's multiple people out there that have NCLEX practice questions. If you want to contact me directly, be happy to talk to you about those. But any app or program that you want to use for NCLEX practice questions, that's going to be key to you getting the opportunity to test your ability to answer content, to respond to questions, to kind of pick up patterns in the way you're answering the questions. Now, here's where it all comes together. You need all of those supplies and you need an individualized plan. Now, most of us do not like being held accountable. It's kind of uncomfortable, right? That feels weird and we don't necessarily like it, but it's the best way for you to walk into that NCLEX as confident as you can be and to be successful. So the key is, I hate cookie cutter plans. I love these NCLEX review companies that have these, well, if you have 3 weeks, you should do this, this. No, everyone's life is different. And things that are important in your world are the first thing I want to address. Maybe you have plans to be with family. Maybe you have a certain day of the week that is a day of worship or faith or meditation for you. And those aren't great days when you're going to want to study. The important thing is I want you to start with a blank calendar. And the first thing you do is mark off the days that are no study. Okay, there's going to be days where I just want you to own it. You're not going to study. So first thing is I want you to take a calendar and take a blank one. There's no magic in this. I just like the font on it. But I want you to take a blank calendar and I want you to mark off the days. Now we'll look at an example a little closer, but you can see here, I've got some X's here in the month of December. We just use that as an example because some people are graduating. Some people have Christmas plans with their Nana. Some people have New Year's Eve plans with friends. Some people have recovery plans for the day after New Year's Eve. But the key is individualized plans are realistic. They're what you're absolutely willing to do, not what you think your fantasy life student somewhere is willing to do. It's what your life and you are actually willing to do. So first of all, be thinking, what are the non-negotiables for you? And let's take a little closer look at what we have here. Now I've got a couple examples here. I just picked 2 months randomly. I picked the end of the year 2020 and I picked the beginning of the year 2021. Now we've got the month in the top. The format that I'm doing here doesn't matter at all. The key is you need to print it out on paper, write it out on paper first, and then go digital all day long. If you want to be digital, that's fine. But take a look at December. Look at some things I did. First of all, RR at the top means review rationales for me. So I said, like, say you took the review course for 3 days, and then in the evenings you did the pharm sessions. So you see that in our practice month of December. Then you'll see that I have 08 to 10 written up there. And on the rest of the days, like 21, 22, 23, you see I have 08 to 10. For me, my brain is most alert and awake and able to process things early in the morning. So I set a consistent time. 8 to 10 is when I'm going to do things. Now, I have writing activities that I do because I've already taken the NCLEX, but this is really important that you set a consistent time. Just don't think, yeah, I got to study today. It won't happen, right? So you have to plan ahead. Now you see I wrote off just in case, since we did the month of December as an example, maybe people are graduating and moving. I'm just going to own on those 3 days, I'm not studying at all. I'm going to be focused on celebrating graduation. I'm going to be moving. I'm not studying those days. And instead of feeling guilty about it, I own it. I just got it right there. That's what I'm doing. Now let's look at what the writing I have in green. Now you also see the other days I marked off, right? 25 is Christmas with Nana. 27 is just a day off, and I don't need to say why. The 31st is a day off because that's New Year's Eve, and that's a big holiday for some people. And then you'll see, like I said, January 1, that's recovering from New Year's Eve. And on the next month, I wrote still recovering, maybe on the 2nd, depending on what your celebrations are or what your travel plans are. So first step, print out a calendar. Second step, write in the blocked off non-negotiable days, okay? So maybe also options are days of meditation, days of worship, days of faith that you don't want to study. That's good too. But pick a time and pick a length of time so your family, friends, and your life will know, yep, that's when I have it blocked off and that's when I'm going to do it. Now let's take a look at the date, the 21 in December. See, I have 35 and the question mark and RR. Well, that means on that day, I plan to do 35 questions, 35 NCLEX questions, and then I'm going to RR, review rationales. So I'm going to take those 35 questions in a row, not going to stop. Then when they're all done, I'm going to go back and look at the rationales for that question. So whatever app you pick to do practice NCLEX questions, please make sure they have rationales for every right and every wrong answer. Go back and review those. See, oh, that's why I missed that. I missed that something in the stem of the question. I missed something in the answer choices. Oh, I didn't know that. Add it to your notebook. So whatever kind of notebook it is, I want you to add it to your notebook because you're going to make this part of your study plan of reviewing this and asking yourself the questions. Why does a nurse need to know that? How would it keep a patient safe? So let's look at the 21, then the 22. Look at that. Now it says 40 questions and review rationales. So you'll see that for those 2 days, I start at 35, and then I'm going to gradually increase the number of questions. As you look all throughout and on to the January one, every day I'm going up about 5 questions. Now you can alter this model however you want to do it. You have to see how long it takes for your school's results to usually get processed through. So many of you, as you graduate, you don't know for sure what test dates are going to be available. So it's kind of tough to pick a date, but don't use that as an excuse. Okay, so just go ahead and pick a date. I wrote this out assuming that maybe the student could take it in the week of the 18th of January, somewhere in there. But I just wanted you to get an idea. This is a pretty rough schedule. You're 2 hours every day, consistent, answering questions, looking at rationales. So you may not want to go at this pace. You may want to take it a little slower. That's completely up to you. I just wanted you to see this kind of overall format and option. Now, this is a minimum study plan, right? This is what I would think would be the minimum you would want to do to get ready for the exam. I've also got some things in here like looking at lecturio and notes and studying with a worst case scenario chart, taking notes like the way that we talked about yesterday. You have access, those of you that have taken the course, you have access to all of the lecturio videos. So there's hundreds of hours, right? Thousands of videos, hundreds of hours. It's got a really good search feature. So you just pop in what you want to study and everything will come up for you. So be selective. All lecturio videos are less than 10 minutes, so you're not going to have to wade through 3 hours of a lecture to find the piece of information that you want. So remember, you have that resource available to you. You can also plan in here other options of using your favorite study guides from nursing school. It's completely up to you, but remember, you know your brain. You know what works best for you. Just be brutally honest with yourself. Set times, keep yourself accountable. So you see on this one, like I said, I've added up to about 840 questions. Now you can adjust this. And if you want to write out a study plan and take a picture of it like this and send it to me in my email, do it. I'd be happy to look at it. If you'll write one out, I would be happy to look at it and talk about it with you. But do this work first and then send it to me and I'll review it. Now you'll see on the January one, I said WINM. That means what I need most. So maybe you may not know that until you get to that point in your study plan. So I just write in, you see like there on the 11th, I wrote in WINM. That means whatever I feel weakest or shakiest on, that's what I'm going to do. So this is an example, but it's not one that you have to follow. It's just to give you an idea of the kind of things that you can put on a study plan. But please write it out first so you see the whole picture. See, this is a lot harder for me to put off studying when I know, hey, if I blow off studying today, this is how far behind I am. I'm behind 45 questions and 2 hours time. Now I got to try to make that up someplace else. So this is just a way of keeping yourself accountable without hearing one of our faculty voices, right, in the background in your mind. So this is what the study plan tips are going to be the most successful. Set a goal test date. Remember, we talked about that. You won't know exactly what's going to be available. Pick one anyway and set up a study plan. The worst thing that can happen is you have more time than that, and that is not the end of the world, because the goal is the day before the exam, you only do things that feed your soul. So if there's people in your world that suck the will to live, avoid them the day before your test. If you're married to them, if you birthed them, if they're just friends, the day before the test, you do not have to be with them. That's the rule. Remember, block off and own the days you won't be studying. So like on this one where we said Christmas with Nana, no studying. New Year's Eve, 2 days of recovery, no studying. So block them off and just own them. On those days, you won't be studying. Don't invest precious cognitive energy in making yourself feel guilty, because it doesn't help you study more effectively and it just kind of drains you. Consistent time each day if possible. That's one of my top tips for doing that, because if you just think, I'm going to study tomorrow, really doesn't happen. You know how I feel about Pomodoro. With the procrastination parking lot is essential on how to spend those 2 hours. Keep track of the study time that you invested. Keep a running total. It's a way to feel really good about yourself, because you're like, hey, look at that. I'm at 175 hours, or whatever time you're throwing in there. You've got a running total. And that way you don't trick yourself into not studying and being all surprised when things are hard. So if you keep that cumulative total going, that'll help you stay motivated. Now, I want you to write specific preparation activities for that day. I've got a list for you, so you can, and I've sent those to you in your email, but I've got a list for you, so you can even just put down the letter that represents the specific activity for that day. Make sure you tell yourself how many questions you're going to do that day and review. Don't just leave it up to chance, because really, this is hard, it's tough, and you need to pull out all the stops and keeping yourself on target. Because I want you to refocus this valuable machine and all of your cognitive resources. See, we all have habits. Procrastination is a habit. So you have to be intentional about establishing productive habits for NCLEX prep, and it's all up to you. Scheduling time now will reinvest your energy, because you don't have to worry about feeling bad and I should be studying and I shouldn't do this. No, you're going to own, like, nope, I've got that scheduled. I only have to think about NCLEX these times during the day. Otherwise, then I can release my brain and let it be free. Because the fewer decisions you have to make, the more brain power, the more cognitive load you have available to invest in studying and processing NCLEX information. So if you've already decided, I'm going to study on these days, I'm going to study this long and this many questions, you don't have to make that decision every day. And I promise you, that energy will benefit you much more than trying to make all those decisions if you make them ahead of time and you just follow the plan you made. Now, a focused brain, I want you to take a look at this. This is from one of my favorite books. But you'll see down here, this little ball is like a pinball machine. Boo, the thought goes by. And sometimes we get stuck on something and we just get so focused and we can't solve it. And we can't see the connections and we get super frustrated. But if you will see the other side of that coin, you're putting thoughts and information into your brain every time you take a question, every time you write a note. But you need to step away and let your brain have diffuse time. So focus mode is really studying, really focused, really effort. But when we talk about over here about diffuse mode, look at what's going on with that thought. Yeah, it's making friends. Look, boo, boo, boo. It's starting to make connections that there's no way it would have made unless you gave it time. See, when you take in knowledge and information in your brain, it's kind of like planting a seed. It needs time to grow roots and connections between your neurons so that information becomes your own. Because a focused brain is hyper-focused, it's rational, sequential, it's very analytical, and it's concentrating, it's all prefrontal cortex. But here's what your diffuse brain is. It can work on things in the background. So if I put my time in studying, when I go out and do something that I actually enjoy, being with friends or family or by myself, or watching something, a movie, or listening to music or painting or whatever, just anything that I enjoy that is not NCLEX, my brain is still going to be working on those things in the background. I might not be actively focused on them, but now I start to get this big picture thinking. And look at the difference. Focused brain, all right here in the prefrontal cortex, right? Diffuse brain, it's all over my brain, and I'm starting to make connections. That's why focused periods of time with breaks in between is going to be your most effective way to put information in your brain in an orderly fashion, especially if you use our worst case scenario method. Put it in an orderly fashion and let it kind of hang out in there. And when even on your downtime, your brain is going to be making connections. Then the next time you come back to study, you're going to make even more connections. Because here's what happens when you get angry or frustrated. it shuts down logical and key areas of your brain. So when you get frustrated or when you're getting lots and lots of questions wrong, you just keep pushing through. We call that misplaced persistence, because you're just going to make yourself more frustrated, and it's not a really productive way to take in information. Hey, life happens, things happen, and you're not likely going to be able to be perfect on your plan. But as long as you hit your plan the majority of time, that's what we're hitting for. And when you start feeling yourself get really frustrated, that's your signal to switch to diffuse mode. Your mind's going to keep working. Get good rest. I promise you, rest is one of the healthiest things you can do for your brain. And your memory and thinking and learning will go on during those times and during diffuse times. So your brain needs that time to refresh and kind of do some housekeeping and put things in order and process information. And when you're sleeping, that frontal cortex is deactivated. So don't end up with a brain that's all locked up like this. Know that, hey, I have a plan. I'm not just winging it. I know what I'm doing. So I have the freedom to know that some days I'm going to miss the mark. That's okay. If the majority of the days I'm able to follow my plan and follow through. And when I get frustrated, there's a word we use, I'm stalling. Just, ooh, you're so frustrated. You know that you need to take a break. Go do something diffuse that has nothing to do with NCLEX, then come back and try again. Because see, this written plan that you're going to make is going to help you clarify your most important priorities. You're going to be able to have a balance, because remember, you need and you deserve NCLEX free time. You will be better because of it. Now, this is going to give you a filter. When you have a written plan, it'll help you say no to things that are obviously more attractive than studying, but you'll know that they're lesser things because they're not going to move you towards your goal. Now, you always want to look at empowering yourself, because you want to address right where you are. Hey, here's my current reality. I'm done with school. I graduated, but now the issue is I've got to put this information and get it organized in a way that I can be successful on the NCLEX. Because a written plan will help equip you to know that when I walk into the NCLEX, I can say, I did my very best to prepare. So use this written plan as a roadmap for helping you accomplish what matters the most, and that's being well prepared for the NCLEX. Because we want to help you make sure that you don't walk into the NCLEX with any regrets. And if you make a plan and you follow it, that's how you do it. So commit tonight or today, whenever you're watching this video, that you're going to sit down and write out a plan that works for you. Committed times, numbers of questions, blocked off dates that are non-negotiables when you're not available for studying. Now, I told you I'd give you an option to put on your plan, and you see I have them here, A, B, C, D, E. So you can write these right on your calendar instead of having to write everything out. A just means I'm going to answer NCLEX questions from the app that you choose to use, and I'm going to review them. Answering questions is good, but reviewing the rationales is really important. So B is reviewing rationales. You read the question, the right and wrong answer rationales, make notes in your NCLEX notebook, and use the worst case scenario strategy whenever you can. Now, when you miss a question, you want to think about, oh man, why did I miss that? Maybe it was you didn't know the content. Understandable. Because remember, we've already said there's going to be content that you don't know on the NCLEX, and it's okay, because you're going to what? Elsa that. That's right. You're going to let it go and move on. Now, the second option may be you missed something in the stem of the question. So ask yourself, hey, did I do the work to put this question into my own words? Did I look at every diagnosis or procedure and think, worst case scenario, how would I recognize it? What would I do? Did I think about with a number? Is that high, low, or normal? Did I look at assessment options and say, hey, is that normal or abnormal? Those are all parts of processing the stem of a question and putting it in your own words. Now, if you miss something in the answer choices, did you fail to eliminate the answer choices and say why you did it? So see, when you're reviewing these options right here in number C, pay attention to what is most often catching you, because then you'll know how to correct it. Now, D is, hey, watch some lecturio videos or some other source, whatever you want to use to help you refresh content or areas that you feel kind of squishy in, not as strong. That would be letter D. And E is review your NCLEX notebook. Remember, every piece of information in your notebook, you want to be able to say, why does a nurse need to know this? And how would it keep a patient safe? That's because you're training your brain to take bits of information and answer those high level NCLEX questions, because that's going to trigger your brain to recognize when they're asking you to prioritize a question. So, what I want to close with today is your brain is an incredibly valuable resource. Don't buy into how you feel after all the challenges of nursing school. I promise you, you are bright, you are sharp, and we need you in nursing. Remember, you have all these resources, all that video content and lecturio. That's thousands of videos and hundreds of hours of content. So be sure to use the search feature. And also, what I don't want you to shortchange yourself is you have phenomenal knowledge that you learned and earned and worked for in nursing school. So go out there, get your plan ready, and do your very best to walk into that NCLEX as prepared as you can be to be successful. So I'll see you soon, future colleagues, with RN after your name. Hey, have a great night, and please send me any.
Thank you.
Thank you.
Yeah, yeah. I want to ask the question.
Yes, go ahead.
Yes. You said you'll be you can suggest, if you can suggest materials for me to. I want something that I can practice how to take the exams, like before the day I'll take the actual board exams, like the sitting environment. If I can practice um, 2 times or 3 times before I'll go for the main one.
Yes, I think that's an excellent idea. Do you want to email me and I will send you a list of resources that you can look
Yes,
at?
please.
Yeah, yeah, and I'll give you
Yes,
kind of a rundown. I'll also email you my cell phone number. So if you
yes,
want to call me and talk about it, I'd love to. I'd love to. That would
yes,
be
please.
my privilege. All right. Any other
All
questions?
right. No, thank you very much. And I'm really enjoying the lectures, the
Oh,
summary, yeah. It's like it's bringing everything back to memory, connecting everything. Yes, although I'm not moving at a faster pace, but then I'm really enjoying it.
you
It's
go at
so
your
it's
pace.
reviewing. Yeah.
Yeah, yeah. Okay. And so I'm going to be looking for an email from you. So go ahead and email me tonight so I can make sure I get those resources back to you first thing in the morning. It looks like we'll be friends till you pass that NCLEX. All right.
All right. Thank you very much. Thank
Good
you.
night.